Okay, today I'm going to be doing a bedside head to toe with a focused assessment on the abdomen. So I'm going to first perform my 8 pre-procedural steps. I'm going to come in, introduce myself, and then have the patient introduce themselves by name and date of birth. I'm going to explain the procedure today to the patient, and then I'm going to state that after conversing with the patient that my patient is oriented ×4. I'll then put on my gloves. I'll start with the assessment of the eyes. So I'd have the patient turn to me, look at the bridge of my nose, assess that the pupils are equal, round, reflected to light, and accommodating. I would then have the patient open up their mouth and say "ah," assessing the mucous membranes of the mouth and nose, and they are pink and moist. Next, moving on to the lungs. I would listen to the right and left side of the lungs bilaterally, taking the breath in and out each side, and then having the patient cough, and then assessing the opposite lung. While I'm here, I would go ahead and listen to the patient's heart. So it would be aortic, pulmonary, Erb's point, tricuspid, and mitral. And I note that there were no adventitious lung sounds, and the heart rate sounds were rhythmic and they were of normal rate and rhythm. I would then move on to the skin, and I would assess that overall the skin is intact. There are no lesions. The turgor returns to baseline in less than 2 seconds, and capillary refill returns to baseline in less than 2. Go ahead and check the toes while I'm here for capillary refill. Again, heel assessment, noting that the skin is still intact. Palpating for edema on the lower extremities. On the upper extremities, noting that there is no edema there as well. And then for the gastrointestinal assessment, I would ask the patients if she had a bowel movement within the last 24 hours, and just noting that, and she did. Very healthy bowel movement this morning. I would assess if she was having to use a catheter, and then assess her skin if she had an IV to make sure that the IV site was intact and there was no evidence of infection. For range of motion, I would have the patient flex, extend, they can circumduct, and then same with the legs, flex at the knee, extend, circumduct, they can dorsiflex and extend the ankle as well. Go ahead and check the pulses on the patient, so the carotid, brachial, and I would do them not at the same time as not to get false readings. And then radial is at the wrist, popliteal behind the knee, and posterior tibialis at the ankle site. So then for the lungs posteriorly, I would have the patient make sure that the bedroll is raised, roll over to that side, and listen to each lung in an S pattern, having the patient take a deep breath in, deep breath out, and then coughing once more. I check the patient's temperature. Orally, it is a healthy 98.2, and I would, of course, have the raised bed prior to all of this. So moving on to my abdominal assessment, my focused assessment, I would have the patient continue to lie down, knees are slightly bent, arms can either be crossed over the chest or by the side. I would pull the bedding down and only expose the area that I'm going to be working on for privacy. So with an abdominal assessment, you always want to start with auscultation first, as not to elicit any false bowel sounds. You want to start in the right lower quadrant. So right lower quadrant, listening for normal active bowel sounds. That would be roughly 10 to 30. If I did not hear any bowel sounds at all, I would listen in each quadrant for a full 5 minutes. The right lower quadrant has the cecum and the appendix. The right upper quadrant has the gallbladder and liver. Left upper has the stomach and spleen, and left lower has the descending and sigmoid colon. You're wanting to listen for low-pitched bowel sounds. And then I would move on to palpation. So I'd start with light palpation and then move into deep, but only if there was no pain noted in the patient. So being sure to press down, noting of any hard masses, and then finally percussing, and that would be listening for any dullness. You want to hear high-pitched timpani when percussing. And then covering the patient for privacy once the procedure is done. And then I noted upon inspection of the patient prior to listening or touching that the patient's abdomen was smooth and symmetrical, that there were no scars, striae, ecchymosis, or venous patterns, and no edema throughout the body, no scars, incisions, no wounds. And then when my assessment was done, I would lower the bed down. I would thank the patient for being such an awesome client. I would give her a call light, raise the sides of the beds here, and take any equipment that I used, sanitize the space, and then let her know when I would be back and document my procedure and how well she reacted to it.